video in our high yield pathologies, we are going over the vitamin deficiency disease, Pellagra, which is a deficiency of vitamin B3, otherwise known as niacin. It can also be due to a deficiency of other members of the vitamin B complex, including riboflavin and pyridoxine, and can also be caused by decreased intake of the amino acid tryptophan, and possibly excessive intake of leucine, as well as a deficiency of lysine as well. And Pellagra often occurs in conjunction with carcinoid syndrome and Hartnett. So a little bit of the history about Pellagra. In Spain, actually, a man named Gaspar Casal described Pellagra as the Asturian leprosy. And he described it as leading to dermatitis and its origin being poor diet and atmospheric influences. And this was a big deal because it was the first modern pathological description of a syndrome. And up until the late 19th century, the disease was mostly studied in Europe, up until it became an epidemic in the American South. In 1914, when the US government assigned Dr. Joseph Goldberger to investigate what was going on. And in the American South, meals mostly consisted of the 3 M's, which we have meat, molasses, and meal, meaning cornmeal. And within those years, approximately 3 million Americans were affected, causing more than 100,000 deaths. In 1937, Conrad Alpine made the discovery and determined that a niacin deficiency caused Pellagra and was also the cure by administering that as a treatment option. And in 1938, Time magazine issued their Men of the Year in Comprehensive Medicine to Dr. Tom Spies, Merlin Blankenhorn, and Clark Cooper for also successfully treating patients with Pellagra via niacin treatment. So symptoms of Pellagra are traditionally described by the 3 Ds, diarrhea, dermatitis, and dementia, and there is a 4th D if you include death. Other symptoms include sensitivity to sunlight, aggression, skin lesions, insomnia, nausea, vomiting, seizures, etc. So, diagnosis and testing of Pellagra. So, in order to be able to determine whether a patient has Pellagra, you would want to check whether they have a history of dietary inadequacy of vitamin B3, clinical manifestations, if we remember our 3 Ds, as well as biochemical indices, checking urinary excretions for health factors as well. Diagnosis is confirmed, however, after you see rapid improvements from high doses of niacin or niacin-rich foods. A little bit about the epidemiology of Pellagra. Primary Pellagra is often seen in individuals with alcoholism or those who participate in fad diets that often put them at risk for vitamin deficiencies. Secondary Pellagra is actually very rare, and it is seen in individuals with a natural or a introgenic compromise in converting tryptophan to niacin, which also includes carcinoid syndrome. And of course, patients that are taking TB medications such as isoniazid, ethionamide, and pyrazinamide, which also affect the inhibitors for niacin. Okay. If left untreated, Pellagra often results in death from multi-organ failure. Yeah, it's pretty bad. There are no racial predilections for the development of the disease, although clearly there are economic standards that go along with races that determine whether you are involved with, say, fad diets or alcoholism within your socioeconomic structure. There is also no biological predilection, so men and women will get this just as equally. And as far as age, it's typically an adult disease, and classic symptoms aren't generally well developed in infants and children. So how do we treat Pellagra? Well, we encourage patients to eat foods rich in vitamin B3. And if their symptoms are very, very severe, vitamin B3, otherwise known as niacin, is also given intravenously. And for as far as the skin lesions, topical treatments are given as well. And of course, the number one form of treatment is prevention. So you would want to prevent in the best case scenario, which includes reducing alcohol intake, eating a healthy diet, and taking any supplements such as vitamins if necessary. Thanks for watching our High Yield Pathology video on Pellagra. Don't forget to click a like and subscribe down below to stay updated on all of our future videos. Thanks for watching and stay tuned.